Alright, today we're going to talk about the ESO software. All of the tough books have had this software suite installed on them. It's going to be this little icon right here. This is the local app. There's also a way to log into it using the browser, Mozilla Firefox, to log into the cloud-based app. But we're going to talk about the local app first. So you're going to double click on this. You're going to be greeted with this screen right here. Your username is the number from your state license. If you have a preceding 0, you are going to use the preceding 0. Unlike our old software where it was dropped, we are using the 0 in front of your number. So your password is going to contain both letters and numbers. It doesn't have to be upper and lowercase. If you're having trouble logging on, you're sure that you're using the right password, you're going to come up here, click on this button right here, and click Update System Data. You put your username and password in and click Update System Data. That will make sure that it downloads the latest user list and all the settings and things like that, and that will allow you to log in. Anytime throughout the software, you can use the on-screen keyboard if you're more of a touchscreen type person, but we're going to keep it off for our training purposes. When you log in, you'll be greeted with this page. Starting from the top left, we're going to go to set shift. You don't have to do this, but if you set up your crew and your shift, it will make sure that you don't have to put it into any EHR record that you have. So we have Chuck and Paul here. We have unit 288, vehicle 288. It's just like the old system where you have a unit and a vehicle. And then you've got the AM shift. Again, not necessary, but it will make things go a little smoother. When you want to start a new record, you can click on the new record here. There's another way to do this too in the records tab. Any agency alerts will show up here. We won't do a lot of alerts here because there are some shifts when people don't have any calls, so they're not going to go into this system. But if we want to issue some sort of agency-wide alert, it could be seen here. Fax and status center we're going to talk about at the end of the video. For now, we're going to go up to records. This is where you'll see all the records that are local. So not the ones that have been synced to the cloud, and once you sync something up to the cloud, you can't bring it back down again. It's a one-way transfer system. This is the other place to put a new record, right here. And the last part of this is the message system. It's going to ask you for your login and password again, just for another layer of security. And here's where you'll receive messages from administration, from the QM committee. If you get a letter of commendation, if you get a letter of correction, they're going to be in here. And you're going to know that you have messages because you'll see a little red 1 or 2 or 3 here when you have messages. So you don't have to worry about logging in every single time. So to create a record, we're going to click on New Record. And remember that we're doing records for patient PCRs and also just our standbys and things where we don't leave the station or where we are unable to locate or something like that. So when you open up a record, you're going to be greeted with the top left, the incident and the response part of the incident. It's going to auto-populate this number based on the month and day that you opened the record. So it's going to start out with year, then month, then day, then time in 24-hour time. So this was the record that was started on January 26, 2017 at 14:39. Don't alter this number. This is how we track it. You don't have to put in any sort of number yourself, but this is how we track our PCRs now. Run type is going to be 911, intercept, mutual aid, or standby. Generally, it's only going to be 911 response or standby. We're going to leave that blank intentionally just so that we can show what validation looks like later. When you want to validate your report and make sure that you have everything you need, you're going to click this little check mark up in the top right-hand corner, and it's going to let you know what you need still. Disposition, once we select one that has a patient, we're going to open up a whole lot more of these critical fields about these validation issue, things like that. So right now it's a small list, but it'll get bigger. So when we go to the scene, we almost always go lights and sirens. Sometimes we're downgraded. EMD complaint is not required, but again, you can always put any one of these boxes. You're always going to be able to put something in there. They're not all going to be required for validation. So requested by, initial, responder on scene, estimated, again, none of these are required. Scene. So you're going to have to click over to address every time and select a location type. So most of our scenes happen on homes or street or highways. Sometimes it can be a place of business. Sometimes it's going to be a place of recreation like one of our parks, things like that. For this example, we're going to use a home, and we're going to put the address as 100 Lookout Mountain Road. If you were to run a call on the highway, you could instead write, for example, in the address, not in location name, I-70 eastbound mile marker 254 in the address. That's acceptable. We'll talk about how the mileage calculation doesn't work if you do that, but we'll get to that in a moment. So all of our addresses here are 80401. Makes it nice and easy. And it is going to require you do city, state, county, but instead of typing all those in, it would be easier for you to just search from the zip code. Zone is very important, and it works the same way as it worked on the old paper records. The zones are either I-70 Foothills or Genesee. All these are for our other districts outside of our normal response. But I-70 Foothills, Genesee, and it has to do with what fire department you're responding with. So Foothills is going to be anything with Foothills Fire. Genesee is going to be anything with Genesee Fire. So this one's Foothills since it's 100 Lookout Mountain Road, and your mass casualty event, whether it's a mass casualty or not. So for your non-patient PCRs, your standbys and smoke investigations and such, you're only going to need a lead. However, for this one, we're going to pretend it's a full PCR, and we're going to have Paul driving and Chuck in the back with me, like that. If you need to add a ride-along, you can add a non-crew member. You can put their name in here, and you could put that they're affiliated with a student or an observer, things like that. They're always going to be other, like so. The disposition. Now, this is where things get a little tricky. We have a lot of dispositions here, and not all of them are inherently going to make sense as you're familiar with. So be sure to consult the cheat sheet that I've posted around the station and the cheat sheet that is available online on the website and has been emailed out to all of you for full descriptions of everything. Right now we're going to do transported, no lights, no siren. These are in order of the kind of the most common ones are at the top. So this one's transported, no lights, no sirens. We took them to the hospital due to it being the closest one, and we are in ALS service today. For hospitals, you're going to leave it on predefined. We've put in all the hospitals here. For now, we're going to use our practice hospital, which has our address at the station and our fax number at the station. But if we were going to St. A's, we can just put it there. It already knows the address of all of our places. It already knows their fax numbers. This area right here is for syncing software that we don't use, syncing with the hospital. So go ahead and leave that blank. No worries, just pass it on by. For the times, works exactly the same as it used to. You put in the time for call received, dispatch, and route on scene, at patient, and so on. We're going to set these all to be right now just to make it a little easier, except for this last one that we're going to put at 1600. If you have a vital out of order, like you have some vitals that happened after you drop the patient off at the hospital, it's going to come up as an error for you. Over here, if you're just interested, you can see what your shoot time was. Our shoot time was only 1 second since dispatch and en route was only 1 second apart. These aren't something that we pull or anything like that, so don't worry too much about it. And here you can put your delays. So if we had a scene delay of extended extrication, then we could put that there. Again, none of these are going to be required. You don't even need to put none in all of them. You can just leave them blank. So here's something kind of cool. The mileage system, you can calculate how many miles are between your scene and your hospital if you've put in a valid address. So since we've put in a real address for our scene, we can calculate our scene to our hospital. Our hospital is the fake hospital. That's our station. So it's only going to be a mile or so. You click calculate mileage, and this only works if you're connected to the internet. So if you try and do this on the road, it won't work. So 1.3 miles from the scene, and the scene was just up the road here, to our hospital, which is here, 1.3 miles. You can always put odometer readings. If you run one that's on the highway, it's not going to know what you're talking about. I-70 eastbound, mile marker 254, it doesn't understand that. We've tried several ways to make it understand it, it just won't. So, additional factors, additional agencies, is always nice to say that we were running with Foothills and Jeffco, for example. We can put additional responders here and some comments here if you wish. That's the incident tab. So, moving on to the patient tab. This is where you're going to put in all your patient information, not just demographics, but also history, allergies, meds, and so on. So we've got Joe Schmo here. He's got a very interesting Social Security number. And speaking of Social Security number, please try to get that. We don't ask for a lot of billing information. We don't ask you to necessarily do the insurance information or numbers or Medicare card and stuff like that. But please try to get the social if you're going to get anything. If we have that, then Jill, our billing administrator, has a lot easier time starting the billing process. Don't worry too much about this. This is just patient import. So if we've run on this patient before, we can import them. But again, that only works if we're connected up to the Wi-Fi. So a lot of times we're going to get all that information before we're hooked up to Wi-Fi again, and it's not going to be useful to us. His date of birth was a long time ago. And if you are unable to get a date of birth, you can do estimate age. So you can say he looks about 65 years, like so. We are going to put in his real date of birth because we were able to obtain it. So weight, weight, race, and ethnicity are all optional. We are going to have to do gender, but all these things, just like it was before, you can put it in if you'd like, but you don't have to. Address, you can always do the copy scene. So if we respond to someone's house and that's where they live, you can do copy scene, and it makes it nice and easy for us. Unfortunately, that only goes one way. So if you put in the incident address first, then you can copy the scene, but you can't copy the patient address to the incident. Phone number, driver's license, state, all that sort of stuff, physician's name, all optional. This is a good idea if they have a DNR or something like that, pulsed. Here we call it a MULST. But if they've got it, it's not a bad idea to put it in here, but not required. History, allergies, meds. You're going to click on history. Now, once you click on one of them, you can tab through them like so. And we've got most of what exists in the in the realm of medical conditions. Let's say he's got cancer. And we can add it just like that. Now, to each one of these things, you can add comments, or you can just add other and say other comments. So if he's in kidney failure and you couldn't find that one, then you can put it here. If he's got cancer and you want to specify what kind of cancer he has, then you can put in a comment like that. Again, you can click here and move to allergies, or you can just click on allergies. He's got no known drug allergies, and he takes no medication. Denies all medications, like so. Belongings, there's only the option for other, and then you just add your comments for, his phone. It was given to the hospital, and he had a phone. Just like that. So, that's the patient tab. So, vitals. There's a couple of ways to get to vitals. Our most complete way is here in the vitals tab. But if you say that I was working on patient demographics and I want to throw in a bit quick blood pressure, we're going to talk about the quick options right here. This red lightning bolt, when you click it, it's going to open up in a couple of options. We're going to talk about these three in a moment, but vitals. You can put in a quick 120/80 and done. When you come back to the vitals tab, you'll see that it's in here. Okay? That only gives you a couple options when you do the quick vitals. You've got blood pressure, SpO2, pulse, temperature, respirations, glucose. But if you wanted something that was more complete, you're going to go into here and use this vitals tab. Up here is the time, date, if it's prior to arrival or not. On one of the vitals, you're going to need to put an AVPU. So just keep in mind that this will be required on at least one of your vitals. So say we've got our same 120/80 here. It'll always calculate your mean arterial pressure. You can put that it was on his left side and he was sitting. This won't be required. And you can put the method if you like. I did a manual cuff for this first one. Pulse, you can put not only a rate, but a rhythm and a strength. Respiration, you've got not only rate, but quality and rhythm. And SpO2, ECTO2, CO, you can put at oxygen or room air. He was on 99% on room air, and he was expiring 37 ETCO2. Temperature, glucose, you can put in Fahrenheit or Celsius, and what kind of method that you took your temperature. Glucose, you can put whether it's high or low on our machines. Sometimes it gets a little bit too much, but let's say he just had a 108. That's just fine. For your scoring cards, this is nice because the GCS will help you if you do not remember in the heat of the moment exactly what each one means. You can also do min or max 15. Let's say that we've got a senile old man who is confused, but he always is. You can put as a qualifier that this is normal for the patient. Just like that. If you so choose to use a revised trauma score or a pediatric trauma score, they also will help you with those. ECG. So we have another video. It's going to be right below this one on the website on importing the ECG material and the data from the LifePak 15 into this system. You're going to have to use that if you run a 12 lead or any sort of electrocardiogram. But in this little tab right here, you're going to put your interpretation. So sinus rhythm, 12 lead is when you type in NSR at 65, normal sinus rhythm 65. If he's got ischemia, you can put what kind of ischemia he has, and if he's got an MI suspected or not. Just like that. These are just your kind of extra stuff that happens in a 3-lead. Your pain scales, you've got these little animated faces for kids. Those are kind of fun. Or you can use a numeric scale like most people use. So that's all of the different vitals that you can put in. Once I press OK, it's going to do that, and they're all in one line here. So each line is a different time that I entered vitals. So if I wanted to edit or delete these quick vitals I did before, let's say that I decided I was just going to do a full one instead of those quick ones, I could go in here and delete that, no problem. When you switch, it's going to keep where all your scores and the lines consistent, and it's just going to be the different parts of that. So when you do your monitor import, it's going to be here. It's going to be here and local. And like I said, there's another video explaining that fully. And that's your vitals tab. Moving on to flowchart. This is where we had procedures, treatment, medications, all sorts of stuff like that. Pretty much all the stuff you do to a patient. So a couple things to note. IV therapy. When we do an IV and a blood draw, you need to do an IV and a blood draw. You need to do 2 different flowchart items. So we'll just do an IV real quick. Our fluid is just going to be a saline lock. We used a 20 gauge. And I'm demonstrating right here. You don't have to necessarily click or touch everything. You can tab through it. So I'm using just the keyboard now. So site, we're going to say it was antecubital left. Total fluid given was 0. It was successful. It's going to default to the provider being the lead provider. But let's just say that Chuck got this one. Patient was unchanged, improved, worse, not applicable. For an IV, it's usually not applicable. There were no complications. And our medical control is going to talk about whether you had to call in for it. So our IVs are all protocol. They're all standing order. If you have a doc that tells you to do something, that's an online medical control. And it's a good idea to say that MD Bill Lutheran authorized. Okay, MD Bill at Lutheran is a good idea to put who authorized it. Obviously, you have a character limit here, so you can't write all of that. So that's your IV therapy. Blood draw is going to be a very similar sort of thing. You do size, site, things like that. And then you press OK, and you'll see that we have a blood draw done by me because we opened it, and an IV done by Charles here. If you wish to edit or delete any one of these, you just put it right there. For our medications, we have all of our medications here, and we have them both in trade name and in generic name. So we've got ondansetron and Zofran, no difference. It's just that sometimes when you're working fast, you got an emergent situation, you can't remember which one, you can't remember either the trade or generic name. We put them both in there so that it's nice and easy. For these, we've started out to standardize it at the dose that you're going to give, so 4 milligrams intravenous. But if you were to give a different or by a different route, you can change those sorts of things. Again, provider, things like that, complications can all be put in there. We're going to delete that. One thing to note, last thing, airway is where you will find oxygen. Oxygen is not under medications, so keep that in mind. Airway is going to be all of our airway maneuvers, including just OPAs, NPAs, things like that. Critical care is only ALS assessment. So when you do your ALS assessment, just click that. Defib, cardiopace, all sorts of electricity and CPR sorts of things. Medication is going to be all our medications. And then others going to be things like bandaging, 12 lead, BLS assessment, burn care, general comments. General comments is a nice one. You can just say when something happened, tourniquet, stretcher, Spinal immobilization is here. Yeah, there it is. Things like that. So this is where we'll talk about these three. These three up here, again, let's say we're somewhere else and we're doing CPR and we wanted to say that we gave epi right now. You go to CPR, and here under CPR is going to be most of the things that you use for anything in CPR. So we've got our epi 1 to 10 right there. Easy peasy, and it was nice and quick. And it brings us back to where we were. So in the flowchart item, you'll see the epinephrine. Not much is going to be in here. It'll just default to its doses, but you still need to go in here that he was unchanged, he had no complications, online or protocol, things like that. You need to fill in some extra data, but it helps you do things when time is tough. General is going to be kind of our most common procedures, and then medications, I just put in our most common medications given, just like that. So those are all your quick options, and that's the flow chart in general. Moving on to assessment. In this tab, we have the anatomical, kind of the Ken doll version that most people are familiar with for trauma, usually for trauma. You don't have to use this, but you're certainly welcome to. We can say that we're going to zoom in on his arm. Yeah, here we go. Zoom in on his arm, and let's say that he's got a burn right here. We can put that just like that. Nice and easy. If for some reason this model isn't accurate to what you think that you've got a patient, maybe you haven't put the gender in yet and it pulls up a man for a woman, you can always change to the other models. When you change models, it will delete all the information that you have. So female, child, infant, and so on. It will default to the one that's right if you enter in that you've got an adult male like that. So we're going to put that burn back on there. Most of the assessment is going to be done here in the quick assessment, and these all default to not assessed. The only one that didn't was the extremities because we put a little burn on his arm. So if you read this, if no abnormalities is selected, all listed abnormalities for category were assessed for and found not to be present. That's a very important sentence. When you click on no abnormalities, what you're saying, and you can click through here and see what this is you're saying that all of these, you did not find any of these to be not normal. Everything is going to be normal. Now, a better way to do this is to not stay in this quick assessment the whole way and just do no abnormalities like that. That's not the best way, in my opinion, to do this. You click on assess, and it keeps you accountable and makes sure that you've checked for all these things. You can do alert and oriented times 4, excuse me, and you can go through and say he's negative for all of these things, just like that. If you click no abnormalities, it will actually just reset everything to no abnormalities. But I like these other options here. So for mental status, we've got this. Skin, warm, pink, and dry. It defaults everything to where the patient's supposed to be. This is particularly useful if you don't practice medicine or you're not as confident in your assessment. It'll help make sure that your assessment is complete and systematic. Head, eyes, ear, nose, and throat. No abnormalities. Perla, you can put the size of each one. So he's got 3 millimeter on each side, just like that. If he's got no abnormalities to his neck or airway. In the chest, no abnormalities, no abnormalities. This clear to auscultations, clear and equal bilateral, basically, just like that. If he's got something going on, let's say he's got decreased in his left upper lobe, you can say he had decreased. And for all of these, you're going to have a comment section, so you can say that he had decreased lung sounds wherever he did. Abdomen, no abnormalities, soft, non-tender for each of the quadrants. His back, we kind of divide it by where the spine is, so cervical spine, thoracic spine, lumbar spine. Pelvis, GI-GU. GI-GU doesn't have a specific no abnormalities or a everything's negative button. You can go through and go negative on all these if you like. His extremities, since we put that he had a burn on his left arm, it's not going to say that we had no abnormalities, and if I click this, it'll tell me you will lose the assessment if you do this. We're going to say that's okay. He didn't actually have a burn. All 4 extremities have no abnormalities. Pulses, again, you don't have to put normal for everything. Let's just say that we took a radial pulse and it was normal. That's good. Capillary refill, let's say that he had good capillary refill on his left upper. We checked his left thumb, and that was good. Comments again, always able to use comments. Neurological, and we're done. So this makes sure that you've done a good assessment, and this will come into play when we talk about our narratives, because Dr. Beckman has authorized us to use this assessment and not necessarily go through every single assessment item in our narrative as we used to. So in your narrative, you can put that the patient was assessed. Obviously, always say that you completed an assessment, no abnormalities found, or you can note, the 2 or 3 things that you found, and you can say see above for full assessment. You also have the option of doing initial or ongoing. So the ongoing will bring up a whole new assessment for you to do. And you're always going to timestamp this one when you start your assessment. So that's your assessment tab. And next we'll be talking about narrative. So moving on to the narrative tab. In the narrative tab, we have a lot more than just the narrative, which is all the way down here at the bottom. We have our primary impression. This is the one where you have to select one of them. It's not always great. Please don't use the other until you really, really look through and make sure that there's nothing here that's even close. So we're going to say that he had a GI bleed. Secondary impression, again, you can put in a secondary. You don't have to. Protocol used, not necessary at this time. Maybe necessary in the future, but is not going to be necessary now. Chief complaint system. We're going to make sure it's GI. I'm also demonstrating now that you can do all of this with just keyboard without using the mouse or the touch screen. This is a medical. We're going to keep going. Chief complaint. This is where you can type what you like. Just like that. You can say my belly hurts, things like that. Under supporting signs and symptoms, you can also add that he had abdominal and he had epigastric pain, for example. If you type not abdominal, let's say that you put in a dislocation, it's not going to give you epigastric pain for that. It's going to make sure that all the options here are appropriate. So let's say he had epigastric pain on top of that. So duration, he had this for 1 hour. Secondary complaints, duration. This level of distress is going to be somewhat new to our BLS level members. There's nothing really fancy to it. Just use your best clinical judgment. Would you classify him as being in mild distress, moderate distress, severe distress, no distress, things like that. So anatomic position would be where his injury is, if he has an injury. For this might be abdomen. And specifically when we talk about injuries and injuries here, it's trauma. So when you type yes here, it's going to ask you about a lot more details. So primary injury, let's say he was in a motor vehicle accident. It's going to ask you what kind. He was in an auto traffic accident, auto ped. He was somewhere else. He was on a street or highway, things like that. This is really going to be for your trauma. He was not injured. He did not have any trauma like that. Here's where you can put your barriers to carry your alcohol and drugs. We had no barriers for him, and we had no alcohol or drugs or anything like that. Not a pregnancy. How was the patient moved to the ambulance? So generally it's going to be stretcher-assisted, stair chair. You can also put carry or other here. We're going to say that he was assisted. He walked to the ambulance. And from the ambulance, it should always be stretcher. We don't have times where we walk them into the ER. They're going to be transported on the stretcher to the ER. During transport, they're generally going to be one of these. Pretty much all of the options are here. Semifowlers is the most common, and we're going to say that he was unchanged. Here's where you'll write your narrative. It will require you to put something in here. Again, as per our usual policy, you can use any system you like, as long as it's systematic, as long as it is complete. If you're using a good, you're following a certain way of doing your narrative, it doesn't matter which way you do it. Try to be consistent. Try and have a system and then stick with it. And like I said before about the assessment, you don't have to put the whole assessment in there. You can put that you did an assessment, you didn't find anything abnormal. You can see above for the full assessment details. So that's the narrative tab. We're going to move right on along to the forms tab. This tab is going to be mostly useful and just good information for you to use. My personal favorite is the Cincinnati Stroke Scale. Sometimes it's hard to remember exactly what the screening criteria are, but you're going to have them all laid out for you in a very simple, systematic way. facial droop, arm drift, speech. You can see that he doesn't meet screening criteria, but as soon as we put in arm drift as abnormal, it is going to be screening criteria met. Make sure you put in a time. They're at the hospital, they're going to really, really want that time. Just like that. Okay, these are never going to be required, but they are useful for you. If you're doing an advanced airway, Mallampati classifications are right here, airway gradings. I know it would be tough for me to remember off the top of my head exactly what these were. Indications, monitoring devices, rescue devices, failed intubation, things like that. Motor vehicle collision, it'll help you remember the questions you're going to ask, like collision indicators is a big one. If you had a death in the same vehicle, an ejection, intrusion over, these are going to be high index of suspicion items that you're going to want to remember. So that's your forms. Under billing, you don't have to fill in anything in the billing tab. Again, if you want to, if you can put in their insurance card and you have time and you're going to do that, please do. It's always going to be useful, but you're never going to be required to. This goes on for a long ways. Don't worry about the consumables. That's adding like what sort of equipment we used, and we disabled all of them, so don't worry about that. So moving right along to signatures. This top one is going to be all about the patient, and then these two are about us as providers. So on a normal patient who's alert and oriented and can sign for himself, that's going to be right here. Patient authorizations, got this big long paragraph, and you say, I agree to HIPAA and billing. You click here and you have him sign, just like that. If the patient's unable to sign, you can click those boxes, and I personally like to put a nice big UTS in here and maybe ALOC. If I've got a touch screen and I can write a little bit more precisely, I'd put ALOC or another reason why he was unable to sign, just so that it's nice and clear that the patient did not sign here. We're going to pretend he did. If the patient puts an X or something like that, it's a good idea to have the patient's spouse, son, father, something like that, someone else who's there as a witness to his signature, helps us out. If the patient is unable to sign because they have an authorized representative, if they're gravely disabled or a minor or something like that, you have the authorized representative to put right here. Reason they're unable to sign, printed name, and the signature of the authorized representative. If it's down to us signing for the patient, the EMS providers or the hospital signing for it, that's what this third one's for. So you put your unable to sign there, you put your reason why he's unable to sign, your printed name, and my signature right here, which is hard to do with a mouse, just like that. It's a good idea if you have to do this to sign it yourself and have the nurse sign it as well, the faculty who receives the patient. It's a good idea to have them do it too, just because this is kind of our last-ditch effort. This is your patient who is, for example, a motorcycle accident, who's unconscious or something like that. We don't really know who they are. No one else can sign for them, so we sign for them. That's what that case is for. Under a normal circumstance, it's just going to be this one. This is where you sign it, and even on a PCR that is not, a report that is not a PCR, so your standbys, your smoke investigations, like that, it is going to require that the lead signs it. So just like that, and that's all that's required, even for the PCR side. The lead needs to sign it. You can have everybody sign it if you like. You can have all four of the possible providers sign. Under here you have the other options, so you can have Chuck sign there, and so on and so forth. Here's where we get the nurse to sign that they received the patient, printed name of the nurse, and the signature of the nurse. You do not have to have them sign for paperwork received. It's not a bad idea to have them sign that you gave them the NPP. And down here at the bottom we have airway confirmation signature. Again, not required, but it's a good idea if you do an advanced airway, if you do an endotracheal tube, that you show the doctor your good waveform ETCO2 and then have him sign that it was a confirmed airway. If you use narcotics and you need to waste narcotics, that's where our controlled substances comes into play. We have the medications here. We do have all our medications here, but you obviously only need to sign when you waste a controlled substance, so our fentanyl or our Versed, the amount that you wasted, name of the witness, and the witness right here. So that is really the end of the full PCR. When you are done and you're ready to submit your PCR, you're going to come up to here and you're going to do your validation. Now you can see that I did not finish my validation. Let's say that I'm all the way over here in signatures and I skipped that run type at the beginning. No matter where you are, if you click on this right here, it'll take you exactly to the box that you did not fill in. So sometimes it's that you didn't put in which provider did a medication. You didn't fill in it could say that you didn't put an AVPU in one of your vitals, so it'll bring you to vitals, things like that. This was a 911 response, so we're going to put it just like that. Now that we're fully validated, we're able to lock the record. Once we lock the record, we can't edit it anymore. If you need to add something to your narrative, you can issue an addendum once it's locked, but you can't edit anything else in there. So don't do this until you're ready to do it, until you're ready to be done with it. We're going to pretend like we just locked it. When you lock it, you can press home and it'll bring you back to your home screen. You can look at your records here. First of all, on the home screen, you'll see that you have 1 unlocked records, 0 locked records. That means that's what's on this computer right now. In the records, you'll see we've got our Joe Schmo here at 100 Lookout Mountain Road, and it's unlocked. Once it's locked, you're going to want to fax it. When you click fax, it will fax it to your destination. So if we selected St. Anthony's, it would say, do you want to fax this record to St. Anthony's ER? When you send the fax, you just click send the fax. And we have been experiencing a little bit of a bug with this. What I have noticed is that it is going to seem like it didn't send, but it does send itself. So we're going to receive a fax here at the station because that's our fake hospital that we've set up here. If you go into fax history, like I said, it's not showing. It may take a little while to show, but don't worry too much about that. So I waited about 1 minute and it ended up showing 1 pending here. If you click fax history, you can pull up a window. It may take a second to pull up. There it is. And it says it's in progress. So this is the practice hospital. Fax goes to there. You can see the incident number right there. You can try and resend the fax if you're not happy with how long it's taking or if it fails. But that's the fax status right here. Once it's faxed, you're going to want to sync the records. So syncing the records sends it away from this computer, away up to the cloud. It doesn't go to the state unless it's a locked record that's up on the cloud. So when we sync this record right now, it's unlocked. It's not going to go to the state yet. And we're going to show how to look at that record that's on the cloud. So you can see I can select or unselect various records if I've got more than one. And when I click sync records, it shows 0 out of 2 because I had one that I deleted already on this computer. You're not able to delete records as a normal user, but as an admin you can. And you can see that they're all gone now. Everything's gone from this computer. You go into records, there's no records, and just like that. So on all the computers as well installed is Mozilla Firefox. It looks like this little orange fox going around a blue globe. When you start it up, it's going to default to take you to this website right here. You won't need to type it in like I just did. It'll take you right here. It looks very similar to the login page for the local app. This is the local app and this is the web. The only difference is that you're going to need to enter in an agency. So I'll enter my login here. HRTAD is our agency. My caps lock ruined it. And that stands for Highland Rescue Team Ambulance District. When you go here, you'll be greeted with a screen that looks a little bit different than mine. It won't have the PM, QM, reports, analytics, admin. It'll just have this EHR button. This is where you can see some messages, if we have agency-wide messages, things like that. And you're going to click on EHR. This is where things will start to look familiar. Here's where your records are. Now, when you click on this, you're going to go up to all records, which is going to show the ones that are locked and such. I'm not going to click it now because it'll show some protected health information on our previous patients. But that's where you're going to go if you want to look at your locked records. If you wanted to just upload your record after you kind of got all the signatures and synced your LifePack data and then finish it on a desktop computer, you would just see it here in under draft and mobile records. You see we've got our Joe Schmo 100 Lookout Mountain Road, and I can continue editing it here. Looks just like it did before. The main difference is that it's not going to be possible for you to kind of sign it yourself. You could see that it's tough to sign with your own finger. So if you're doing this as a desktop, get your signatures and get your vitals import, because if you're using a non-tough book, you're not going to be able to monitor import because you weren't able to connect the computer to the desktop. Once you've locked it, it's locked. It's going to be automatically uploaded to the state database, so don't worry about an extra step of posting it once it's been synced up to this cloud. That's really all there is to the EHR software. As a final note, if you have a patient that you transported and you need to, you still need to obtain that face sheet from the hospital. With that face sheet, what you're going to do is you're going to take the face sheet, write this number on it, your incident number. So if you look, that's that first number that shows up, that year, month, day, time. On the top of it, fill out the little report on Jill's box the same way that you did before, and just stick that in there. If you have extra documents, just staple them all together and stick it in there. There's no need to print out the report and fax it to Jill and fax it to the hospital because we already faxed it. In fact, from this web-based system, you can also fax it again if you didn't fax it from the local app. And after you've locked it, faxed it, and synced it, and submitted the other documents into Jill's box, you don't need to do anything else. Again, please look at the video below that will describe how to connect the LifePack 15 to the Toughbook for Vitals import.